Laura, we can't hear you. I think I'm still unmuted, but we can't hear you at
Oh
all.
dear. Okay.
There we go. You come back now.
So we're unmuted now. So now I'm going to have to go probably mute people individually. I don't know why it's.
Maybe you have to.
Yeah, it's not usually when I do these things, it'll let me just mute. Can you hear me now? All right, everybody, please mute yourselves if I haven't got you muted already. I'm trying to see if there's anybody else who's already on the call here who I don't have muted.
I don't know how. Oh, there.
Okay, my apologies. All right, well, welcome everybody who's joining us this evening. We're looking forward to having a wonderful experienced medical doctor, Dr. Susan Clinton, who has tremendous experience in the field, particularly with Lyme disease and a lot of other chronic illnesses. She's going to be joining us in a few minutes and sharing her experience. But before we get started, I do believe that with Dr. Clinton, I do believe that there are some guests on the call who may not even really know what we're talking about. So I'd like to give just about a 5-minute introduction to the company and the products that we're here to discuss and why we're so excited about them. Very, very briefly. This is a topic that we could spend hours on, but I'm going to give you the really short overview here. And the company is called RAIN International. We are the leader in seed source nutrition. And we've been in business for about 5 years now. The company began in November of 2011. And my husband and myself, we've been involved since 2013 when this company opened for business in the US. So why are we so excited about seed source nutrition? Well, we ran a medical clinic, an integrated medical clinic for decades. And our mission has always been to help people optimize or recover their health in the most natural way, involving lifestyle and then in addition to lifestyle, the highest quality nutritional supplements available using pharmaceutical medications when they're necessary, but ideally not depending upon pharmaceutical medications on a regular and ongoing basis. And so we've been on the lookout for a long, long time for the highest quality nutritional supplements that are available to help people optimize and recover their health. And of course, seeds make so much sense because seeds are the source of life. Seeds are the most concentrated source of nutrition available to us from anywhere. You know, every herb, every other antioxidant, every juice, every essential oil, ultimately, originally came from a seed. So seeds are the, really the foundation of nutrition that's available to us. We're excited about these particular seeds because they're powerful anti-inflammatories. And most, if not all, chronic degenerative disease has a very important aspect, which is excessive inflammation. So if we can, in a safe and effective way, help people reduce inflammation, we can help them reduce pain, we can help them get off medications that they'd rather not be on, we can help them optimize health. As I said, seeds are 20 to 30 times more nutrient dense than any other part of the plant. So when we take advantage of eating the seeds, crushed, whole, organic, non-GMO seeds, we're offering optimal nutrition to people. Thirdly, we're very interested in the fact that seeds, particularly these seeds that we're paying attention to, have the highest quality essential fatty acids that our bodies depend upon. Our brain is 100 times more essential fatty, more omega-6 fatty acids than it is any other kind of fatty acids. Our skin is high in omega-6 fatty acids. Our cell membranes, our organs, they all depend on high quality essential fatty acids, and we need to get rid of the toxic, sludgy, dirty oil that, that builds up inside our system, and we need to replace it with fresh, clean, unadulterated essential fatty acids. And the best source of those are, of course, seeds. So, oops, we've got some other folks on the call here. And then finally, we're very excited about these products because when we eat seeds, we're eating ground up, when we eat whole seeds and not simply extracted seed oils, we're eating ground up genetic material. And the whole field of epigenetics and the whole field of transgenetics teaches us that our bodies can utilize the genetic material that we ingest to help repair our own gene structure and help recover health. So there's really 4 foundational reasons that we're so excited about what seed source nutrition has to offer people. And this company, Rain International, has come out with a line of seed source supplements that achieve these goals. So the first product, very, very briefly, is a product that's called Soul. It's a product made of ground up black cumin seed, black raspberry seed, Chardonnay grape seed, D-ribose, and a few other ingredients. And it's a very powerful nutrient formula. It's very powerful for anti-inflammation. It's a very powerful antioxidant. It's really a nourishing foundational product for people. The second product the company came out with is something called Core. It is highly nourishing and anti-inflammatory, but it's also a very powerful detoxifying agent. It features the black cumin seed, the silymarin, which is milk thistle seed, cranberry seed. Milk thistle seed is great for liver detoxification. Cranberry seed is fabulous for kidney and urinary tract detoxification. And in addition to that, it's replete with all of these wonderful alkalinizing, detoxifying greens, such as wheatgrass, kale, spirulina, chlorella, chlorophyll, dandelion. So we've got a very powerful detoxifying agent. And of course, if we're trying to have health, we need to have balance, we need to replenish deficiencies, and we need to be reducing toxicity in our life. We also, in some markets, have a product called Form, which is a seed-based high branched chain amino acid protein powder, which is excellent for people who are trying to lose weight or who are trying to build muscle or who are trying to prevent cachexia and muscle wasting with diseases like cancer and some of the other chronic diseases. We also have a very exciting skincare line, and we have a new product called Bend, which is a seed-based formula, which is excellent for joint recovery, collagen repair, and pain as well. So what we are is a seed source company. We're offering the highest quality, uniquely effective source of supplements. So, Susan, do we have you there? You are here.
Unfortunately, I can't get on with my computer, so I had some technical difficulty trying to join the call on my computer.
It's my fault, Susan.
Oh, well.
Well, here we are. You know what? I'm going to leave it at that. And it is my pleasure now to introduce Dr. Susan Clinton. Susan, thank you for joining us. I know we've got lots and lots of people on this call from all over the place, and they're really anxious to hear how you as a medical doctor are utilizing these products in your practice, particularly with things like Lyme disease, arthritis, chronic fatigue syndrome, even diabetes. If you're using them for diabetes, please, jump in, dive in, tell us what you're excited about and what you've seen in the couple of years since you've joined RAIN.
Well, actually, I joined RAIN in January. It hasn't been a couple of years. I developed a test with live blood microscopy to screen for Lyme and co-infections, which I'm finding a lot of people with chronic disease like rheumatoid arthritis, chronic fibromyalgia, chronic fatigue, lupus. A lot of these people actually have spirochetes and inflammation in their blood. Now, I wanted to do it differently, but my computer wouldn't connect with Zoom. I'm having a lot of issues, but I wanted to show, I guess I'm going to have to show it this way. This is what I see in the blood. I don't know if you can see.
You're going to have to put your computer up and your camera down a little bit.
Yeah, because I wanted to share the screen, and this is not the way I wanted to do things, but, this is my screen share at this point. Maybe I can do it like that. Can you see it?
We can see the side of your computer now, or your phone.
Yeah, this is not. I'm going to try to zoom on, join on the computer. Can you?
There you go. Leave it right there.
Okay. Essentially, this is what I see in people's blood. It looks like this. And that is a sign of inflammation. And essentially you can't absorb your nutrients, you can't absorb your hydration, you can't detoxify. If you're on an antibiotic protocol, you can't absorb it. You can't oxygenate. You end up going to lactic acidosis because you turn on the fermentation pathways because essentially you're hypoxic, and without oxygen, you ferment. That lactic acidosis actually causes more stealth pathogens like Lyme, different co-infections like Babesia, Bartonella, the viruses. They multiply in an acidic environment. And lactic acid is an acid, and that actually causes acidity in the tissue, and that actually causes multiplication of stealth pathogens. The multiplication of stealth pathogens essentially causes more damage, more inflammation, more oxidative stress, and is a cyclical pathway. It's basically a positive feedback loop for damage, and then more infection, more proliferation, and you have to break the cycle in order to stop this cascade of chronic illness. And I believe all chronic illness is related to inflammation and potentially due to infectious causes of inflammation. But there's also toxicities in our environment like EMF, heavy metals, the GMOs in our food, the toxicities in our water supply, in our and just plastics. I mean, all these things are toxic, essentially causing damage, causing inflammation, and these stealth pathogens are another layer of toxicity that causes cellular damage on a microscopic level. And so treatments aren't working because the cells are not foundationally able to absorb whatever chosen protocol. Now, there are no claims with these products because essentially it's a nutritional supplement. It's not a therapy. We want to emphasize that. Actually, with this, there's no claims to any cure of any disease. But when you optimize the body on a cellular level, you can do amazing things. Okay, and I'm going to I'll talk so I'm going to find another really good example of what Sol, especially Sol, just because it has a black cumin seed. Okay, let me show you an example of inflammation, what it looks like under the microscope. Essentially, you see all those fibrin threads? Do you see the fibrin threads?
Yeah, people are muted, Susan, so they're not going to be able to answer you.
Okay, okay. Yeah. So essentially, these are fibrin threads right here that basically are, it's almost like a binder. It binds the cells together. So that's why inflammation causes fibrin formation, which traps the cells in a rouleau formation that prevents the absorption of nutrients of water and causes proliferation of stealth pathogens, further damage. So as we can see, this can, in a patient, I had a client that actually did this within a couple minutes. It's supposed to take at least a half hour for the fibrin to form. So essentially what's going on here is obviously this person has a lot of inflammation. Okay, let me just go on. I basically found out I had Lyme disease, was not treated adequately. I had just given doxycycline. It puts it in a cystic form, and then it reactivated when I stopped taking the antibiotics. And it was a slow cascade. And when I found, I actually discovered this microscopy. I got trained in doing it, and then I kind of had a rude awakening of what happened in my own blood. and it looked like that before picture where it's all clumped and it very, very prototypical. In fact, most of the sick people I see doing microscopy have clumped blood like that. And the sicker the person is, the more rouleau and erythrocyte aggregation you have.
So how much Soul do you give people? How do you treat people with Lyme disease using these products?
Well, it depends on how much they can afford to pay for. Someone just called me. Shoot, I had to decline the phone call. This is where it was bad to be on a phone because my phone goes off a lot. So essentially, when I separated the blood, and Soul is one of the most effective ways of separating the blood, I can actually give a Soul, and 15 minutes later, what I do is I apply it topically. I ask them where their pain is. What is the worst pain? Now, some of the people are like, they're pain everywhere. People with rheumatoid arthritis, people with fibromyalgia. I apply it to the back, apply it to the lower part of the spine. Maybe a finger if they have, kind of arthritic hands. I'll apply it on there. Usually and then I have them take the rest of it topically. So I put about 10% on, internally. I put about 10% on topically, and then I ask them, after about 10, 15, 20 minutes, how's your pain? How's your pain? How's your pain? And most of the time, I would say 9 times out of 10, there's, 10 out of 10, it's significantly better. But there are about half of those people that have pain that's reduced to 0 after like 15, 20 minutes. They can't believe it. They're like banging their hand on the table thinking, wow, I can't, this pain has been happening for 23 years. I can't believe it. They are like in shock. And then I show them their blood. And this is my blood, my own blood, after using Soul. Let's see. I really don't like this method. See how separated the cells are, and there's very few strands of inflammation. I could even pick up a Bartonella right there, which is a common co-infection. I feel like I am in remission because I've optimized my body on a cellular level. I usually only one Soul is really necessary to actually get the relief that these people, I've seen thousands of people, and I'm noticing that one makes them, and then, sometimes they need more layering. If they have severe inflammation, I might give 2. I have countless number of stories. In fact, I just talked to someone today who I have not seen yet personally, but she did a sample of Soul, and she has end-stage COPD, and she has Lyme disease. She's had it for 30 years. I put her on another product, and it helped her a lot. But then when she started Soul and she was running out, she goes, Susan, help, help, help. Essentially, the Soul gave her, she was doing a pulmonary function test, and normally she is short of breath. And they had to stress her out more to actually get she could tolerate, her exercise tolerance was like, it was like 500% better. And this is like, okay, this is a new thing that I just literally talked to her on the phone 15 minutes before this call. And I was like, wow, that's pretty impressive and so we just refilled her order on for a box of Soul. All she can afford is 1 box. Ideally, people with Lyme disease, I would think 2 Soul and 1 core, because Soul, 2 a minimum. If they can, the more the better. But unfortunately, a lot of these people have limited income, limited resources. Until they actually can get some of the bulk shipments, it's very expensive with the shipping in our country. So essentially, what we need to do is I do a Soul in the morning, a core in the afternoon, and a Soul in the evening to kind of spread out the black cumin seed. So, we can maintain that inflammatory effect. Ideally, if they're very, very sick, I would go up to like 3 and 2, 3 Soul, 2 core, or 3 Soul, 1 core. It's really, finances are kind of the limiting level. But what I love about the Soul, in particular is it has the multiple purposes. It not only has 281 times the anti-inflammatory effect of aspirin, but it also, it's equivalent of 20 fruits and vegetables and three servings of seed protein. It actually reduces the inflammatory cascade so powerfully that it prevents the recruitment of pluripotent stem cells to become, cancer stem cells. It literally can be applied topically. It's actually, I'm finding like appetite is reduced. And I find that I myself, I mean, I used to eat a lot. I feel like I don't have the desire to eat because it becomes, I mean, it's so much more nutritious than just food, even organic food. It has, organic food has probably 1/50th the nutritional value it did 50 years ago. So what this is doing is essentially providing the nutrients of 20 fruits. So you don't feel like eating one fruit because it's essentially a fraction of what one packet of Soul is. So I'm noticing that nutrition is the key to health and wellness. It's replacing my vitamin. It replaces any anti-inflammatories. And I'm finding that the people that are on it, when they run out, that's when I hear, oh gosh, get me more. They'll pay an overnight shipment for me to send my product overnight. It's like, okay. Essentially, I think immediately I had clients with a lot of fibromyalgia, chronic fatigue, that when I applied the Soul to their backs and the topically, they've been in no pain in 23 years, 7 years. They've gone to chiropractors. They've been living in pain for years and don't know what it's like not to have pain. And many times tears are shed because they're actually, for the first time, realizing there's hope. And then I show them the spirochetes on the blood, and I will actually let's here's some like babesia. I don't know if you can see it like this. This is not ideal. I hate this, but you gotta do what you gotta do. Let's see, how do I get to my, all right. You can see these subtle inclusion bodies, when you actually separate the blood with Soul. And I use a couple other things too, but that's beyond the scope of this talk. But the Soul is a major contributor to the inflammation. I used to give a lot of enzymes to try to separate blood, but Soul has been, it's key. Let's see if I can get, all right.
So when people apply the Soul topically, there's a question being asked whether you apply any kind of a dressing or coverage, or you just allow it to soak in and...
I just I rub it in there. I just rub it in. Mm-hmm. I rub it in so it's absorbed by the skin. So let me look at some of the other...
Have you had any experience with people who are diabetic with this product?
Yeah, actually, it kind of reverses. It kind of stimulates the production of islet cells, and a lot of times their blood sugars are under control for the first time. One powerful thing that happens with Soul is leaky gut. And I had someone with Crohn's disease. Nothing really quite helped her until she got on Soul, and I layered different products. And she was the one I overnighted stuff to. She literally has like alternate constipation, diarrhea. And when she was on this, she was felt like she was going regularly to the bathroom for the first time in, I think, decades. And she felt like more energy. Now I had a lot of people with toenail fungus are finding it goes away. I personally had, after Lyme disease, I developed a toenail fungus and it went away within 6 months. I used to cover it up and I peeled off. So that often goes hand in hand with the candida, directly tackling candida overgrowth in the gut, because it reduces, even though it has sugar in it, and people are told, oh, avoid sugar. And this is a lot of people they look at the trees instead of the forest. If you look at, when you clinically in the body, you're actually reducing the blood sugar, I mean, they have to have sugar to counterbalance the blood sugar that, okay. I'm trying to find a better way to say this. They actually add sugar because paradoxically, the black cumin seed lowers blood glucose enough that you could become hypoglycemic. So by adding that little bit of sugar, you actually prevent a bottom out. And so in the gut, it actually starves the candida of sugar because candida grows on sugar. So essentially, there's not the sugar there, and then it dies off. And a lot of people get diarrhea and, kind of a detox reaction at the beginning because if they're full of candida, they actually kind of reduce that amount, and that's manifested oftentimes externally with toenail fungus, and the candida eventually it goes away. And leaky gut in the leaky gut is actually one of the major issues. I'm going to look up something else I want to show. It's one of the major issues that I see in probably everyone's microscopy is leaky gut, and there's before and after. It's improved. It's improved because the candida is less, because it's starved out, and then also because Sol has such a powerful anti-inflammatory effect. It actually allows the tight junctions of the gut mucosa to actually become more of a barrier, because the inflammation itself is causing this leaky gut. So by directly tackling inflammation, you're actually essentially healing the gut, allowing less absorption.
We found that that core is also very, very valuable for people with leaky gut and Crohn's. We've had biopsy-proven Crohn's later on after using core, adding core, become biopsy-proven, no more Crohn's. Do you have a comment about Sol or core or both in your own experience? In our experience, both of them are very good, but core is especially valuable for a lot of the gut issues.
I actually believe that the core also is very helpful because it actually helps bind, it actually binds toxins and heavy metals in the gut, which also cause inflammation. So because it's almost like it's 7 green smoothies in one sachet. It has a lot of chlorella, spirulina, kale, wheatgrass. I mean, so many powerful binders. Essentially, it is very good. I think for people with mold, other toxins that need to be bound in the gut and eliminated. So that's where core, is essential. I think ideally, 2 sols and 1 core. Really one. Healthy people should have 1 of each. Actually, just because we live in such a toxic environment, but the core is I think ideally everyone should be on core as well. I'm actually looking at a couple examples of I'm trying to pick out something. This is not like the way I wanted to do stuff, but let's give a good example.
Okay, go ahead.
I wanted to give a good example of what it looks like. What a typical person. This is a healthy person supposedly, and they have kind of a clumped. This is like a typical person, who was feeling kind of fatigued. If you look at her blood, smear, and then I gave Sol and core, and this is. Let me see, Sol right here and core. You can actually look at her cells. This is what Sol does on a cellular level. It separates. Oops. Oh God, this is
So the blood is traveling more freely.
The cells are separated and are allowed to hydrate, okay? While before, if you look at the before, they're shriveled, they're clumped, this is not a bad case, but I actually did see something like hatchlings. This person actually decided to, just get on the soul and the core. And really her issues were resolved. Okay, here's an example. Actually, as you can see, this person actually has a spirochete coming out of every cell, see, I don't know if they can see this. Do you see the spirochete? Do you see the spirochete coming out of here? Do you see this? Okay, this is in every cell, okay? All the Lyme disease is intracellular. So if you are to actually effectively treat this or any other disease, you need to optimize the body on a cellular level to actually separate the cells. And this is where soul comes and core come in. I mean, soul is probably a little more anti-inflammatory because it has more black cumin seed. Core is more of a, more of a detox, but it also has black cumin seed. So it does serve, maybe to a lesser extent, both purposes.
There's a question about, in your video, which is a little hard for people to see in your images. Maybe we can give people links to them at a later time. But what are the white centers? What is the white showing in the middle of those cells? There's a question about that. And then can you talk a little bit also about what the enhanced oxygenation of cells that happens when we give people soul?
Well,
of that.
Okay, the white things, those are candida. I mean, if you're talking about something like this. So I wanted my computer to share the screen. This is not how I want to do it. But that's candida. It's air, it's oxygen. I mean, it's CO2 that's produced by the yeast. Okay, everybody has this because it's basically there's antibiotics in our meats and our milk, and even if you do eat organic, if you ever go out to eat, you're probably eating something with something that feeds the yeast. So okay, the center of the bloods are concave, so there's I can't read that. I'm sorry because I'm on this phone.
Well, the question here is somebody's saying the center of the blood cells are concave. So there's a shadow seen like a disc shale.
Yeah, that's. Yeah, I superhydrate the cells with a water that I use, and that basically superhydrates them so I can see other things. And that's so my test actually, involves a layering of several modalities. But when you have normally it is a concave, like the cells are concave, and there is a central pallor. If you have anemia, that central pallor is much larger, and so that person's anemic. When you superhydrate the cell, it actually plumps up, so you don't have that central pallor, but you can see the organisms easier, the co-infections. And anyway, with soul and MS, I just saw that. MS is basically, I hate to say it, most people I have tested with MS have spirochetes and a lot of inflammation. So if you actually apply soul, people take soul, you're actually reducing the inflammation and you're reducing the MS symptoms. Now there's no cure. This is not, no claims can be made, but you're optimizing your body to function on a cellular level better. So there are no claims to any disease with any of these products. Okay, I have to emphasize that because we don't want them unavailable. Okay, it's like major caveat. It optimizes your body to basically function on a cellular level.
Can you talk about some of the other kinds of conditions people have come to you with, where when you've given them soul, it's helped optimize their health, so they've experienced less dis-ease? Or have you had experience where people have been able to reduce the medications that they've needed to use?
Yes, yes. In fact, I have a client, she's a disabled nurse up in New Hampshire, and she was on 8 tramadol a day, and she was in 15 out of 10 pain. She literally, nothing worked. And she felt like she had gone to doctor, traveled far and wide to get a resolution. I think in conclusion, because the testing is so bad with Lyme disease, because it's an antibody assay, a lot of these times people will just get labeled with a garbage pail diagnosis of fibromyalgia, or maybe even, oh, you're crazy, it's all in your head. So essentially, she was on 8 tramadol a day and so much pain that she felt like she wanted to kill herself. And unfortunately, fortunately, she reached out to me on my Facebook page, and I actually got her on the protocol, and Soul is like probably the second thing I put her on. And literally within a month, there was some detox, but she had actually weaned down to 0 tramadol. And she was actually on 1 occasionally, and she had some trauma. She did lose a grandchild over the summer. It kind of brought back some of the symptoms. So despite having the Soul and Core, and then she did another modality to, some, bioresonance. But essentially, sometimes mentally, when you have stress, mental stress, it overrides even Soul and Core. So, it is a multi-layer approach when you're dealing with people with chronic illness. There's not one thing that's going to fix everything. It's a layering, but, this direct anti-inflammatory is essentially beautiful because it's multi-purpose, nutritionally and it helps with the inflammation, and that in itself, all acquired diseases are secondary to inflammation. And when you tackle inflammation, you can essentially alleviate symptoms of almost anything. Now, so she's on and off, occasionally she takes tramadol, but she takes Soul instead of tramadol.
May I ask you a couple questions that have come from the crowd? I know it's a little harder for you to read them on your cell phone. So here's one. Somebody says, I have a customer in his early 70s, battling candida for more than 5 years, and in the last couple of months has started on Soul and Core. He has other co-infections and also has issues with his own nervous system. What would you advise as the best way to get him results using Soul and Core? And how long do you tell people, Susan, that they ought to expect to give these products to give them a fair trial? Sometimes people notice benefit right away, but what do you tell people in terms of what would be a reasonable time frame?
Well, first of all, depending on the severity of illness, they may need more product. I say, it's a money back guarantee for the first 30 days on the first box. But if they are having breakthrough pain, they need to go up on the amount, and they might have to order some more, to actually as maintenance. So there are some detox. I have sometimes people have they have diarrhea or
have we lost you?
No, I was getting a call.
Okay.
So unfortunately that might happen again. Essentially, they can have, sometimes they have fatigue. Sometimes they a lot of bowel issues. Sometimes they have a rash. I've had some people with a rash. Sometimes people feel tired. Sometimes people have more energy. I've had people, it's so different with different people. In
Asia, sometimes when people have these types of reactions, the response that they're given is take more to accelerate the detoxification process.
I would say a month. I would say people, within a few, give it 4 weeks. Give it 4 weeks, usually, and then after that they can expect, but everyone is different. So I've seen all sorts of things, and some people are afraid, or they have financial limitations, so they don't get enough, they don't get as much as they need.
I
And
like to tell people, if you really want to give these products a fair trial, give them 3 to 6 months. That nobody's gotten their chronic illnesses right away, that we hope and expect that people are going to experience benefits sooner. But in my opinion, a really good trial for these products would be a 3 to 6 month trial. Now, somebody's asking, have you seen any results with ADHD and autism? And if so, would it be soul and core, or in what quantities? Have you worked with folks with ADHD and autism?
yes. I get a lot of people thinking there's a combination of PANS and PANDAS, which is kind of like, PANS is kind of like an autism spectrum sometimes. A lot of times these people have lots of inflammation. The autistic people I've seen have probably the most inflammation of almost anybody I've seen. It kind of parallels that of an Alzheimer patient or very sick. I saw an ALS patient, 3 of them actually, and they have a lot of inflammation. The sicker they are, the more inflammation they have. The more, there are examples where that rouleau thing is like 10 times worse. I could bring out an example, but literally it's like a ball of nothing's going to get in there.
What kind of benefits have you seen with autistic people? How could you describe their experience aside from what you see in terms of their blood?
They oftentimes the people that I have done, after they get their session, your testing, they feel like they're in better behavior. Like all of a sudden the parents are like impressed because they're calm and they're sitting there and they're not going, like disruptive. They're not ADHD. Like they're like very impressed. Like, wow, she's calmer than I've ever seen her. I get these type of reactions. Now I do layer a couple things, and so I'm thinking, well, it's a combination of the anti-inflammatory. The blood was I don't leave. I am very determined to separate the blood out to see if there's anything there. So the core, I usually don't give a core because there's another product I give that it actually will negate, the milk thistle will negate the effect of that. So I usually give soul, but then if they're still persistently clumped, or if they don't want to take that other product, I will give a core. So mostly my testing, at least my immediate, results are with soul only most of the time, like maybe 90% of the time, because they unclump at that point. I've had people layer core. Most of the time they like the soul better. Core is just, a lot of times these kids, they're not like looking at the greater good of their body. You know what I mean? They're just, most of the people don't like the taste of core relative to soul.
Do you have any experience with Hashimoto's thyroiditis?
Yeah, Hashimoto's is almost universally EBV with Lyme disease. Usually when they have spirochetes with a history of EBV on testing, when they talk about, yep, Hashimoto's, you have EBV. Oh yeah, how'd you know that? I'm like, yeah, because EBV and spirochetes actually lend themselves to Hashimoto's. So when you actually reduce the inflammation, their thyroid, their numbers go, they don't need as much thyroid medication usually.
Yeah,
so,
we've seen that as well. Also rubbing the sole right on the neck in the area of the thyroid is very beneficial.
But I've had people on the protocol that I suggest and they're reducing their thyroid meds and they've like, wow, weaning even off completely. I mean, most of the people just reduce, not like eliminate it, but essentially when you tackle inflammation, it's amazing what happens. And most of these diseases, these chronic diseases, is inflammation. So, and this is a foundational, layer of tackling inflammation using soul.
Do you have any experience with people who have actually had their thyroid removed and are on thyroid replacement, like thyroxine for thyroid replacement, when they've actually lost their thyroid, had it taken out?
You know what? No, not with Soul and Core. And those people are going to have replacement no matter what. And so, I mean, I would think, I mean, I haven't, but I'm just projecting if you reduce the inflammation, you can actually absorb, the product better into the cells. So you wouldn't need as much, but I mean, that's because you're separating the cells, you're allowing absorption of the exogenous thyroid hormone. So I would presume, but that is a presumption, not an experiential, you know, data. It's not experiential. It's more.
How about VHL? I'm not sure what VHL is. Maybe you do, or else somebody, whoever asked this question, could elaborate. But somebody's writing here, I have a friend with VHL, and it was only just
von Hippel-Lindau syndrome. Okay.
Von Hippel-Lindau syndrome. Okay. Do you think Soul and Core would help that?
Well, that's a genetic disease. Okay, and that's, you know, and actually has multiple. Well, there's multiple organ involvement. I'm thinking it's not going to eliminate that disease because it's genetic, but it can reverse comorbidities that go along with, because inflammation is basically, you know, targeted. And so, you know, the genetic disease is still going to be there, but the concomitant inflammation, I have not, you know, seen a von Hippel-Lindau. It's pretty rare. You know, it's one of those medical school, it's part of the boards to trick people and get the question wrong. I hate to say it. Not that common. You know, this is acquired disease is really the inflammation where it exacerbates, but I think in everybody there's inflammation because of toxicity in the environment. So it would obviously reduce the inflammation component of the underlying genetic disease.
Can you think of any example where Soul or Core would be contraindicated, where you would think that this is a person you would choose not to give these products to, or in your estimation, generally speaking, are all of the factors, the concentrated nutrition, the anti-inflammation, the essential fatty acids, the ground up genetic material, in most situations, would you think that those are beneficial for most people, even though, of course, we're not targeting any particular disease? Or are there some situations where you would say, no, I wouldn't even give that to this person?
Well, it's food. It's essentially food, and we all need nutrition. And, you know, even some of the other supplements, you know, well, if it's increasing like immune modulators, you'd have to be careful with organ transplants. But essentially what this is food, and you're really optimizing the body. So I think that it would be safe in almost anybody, just because you're not upregulating the immune system. You're actually reducing inflammation and allowing the immune system to work better. But I don't think anyone benefits from
a poor diet.
You know, too much inflammation. Or I mean, this is basically, our food is food, PHOU, you know, food. It's not real. Most people actually have a standard American diet, which is ludicrous. I can't even imagine, but it's not really nutritious. There's very little nutrition. That's why there's so much obesity worldwide, because of fake food. And so I think everybody needs these products, and I can't think of any situation where it would be bad for you.
Do you have any experience with labyrinthinitis and chronic dizziness with Soul and Core?
A lot of times chronic dizziness has to do with Meniere's and inflammation, and it's an organism. Oftentimes it goes along with chronic infection like Lyme, but it also can be viral, labyrinthine, or it can be idiopathic, which is probably self-pathogen. So when you reduce the inflammation, I would presume, and I have had people with less dizziness, you know, constitutionally they feel better. I wouldn't know if I wouldn't really call it labyrinthitis in everybody's case, because in Lyme disease, it's sort of a syndrome of a lot of different clinical symptoms, most dizziness, headaches, muscle aches, night sweats, anxiety, insomnia, lack of focus, brain fog. I mean, these are the universal symptoms, and oftentimes dizziness is just put in there along with it. So I wouldn't isolate that as acute labyrinthitis. Maybe a doctor might have just not looked at the whole patient and just pinpointed that, because I think our medical system has, I hate to say, being hijacked by looking at the trees and not the forest. The forest is burning and they're worried about a twig in the forest, overlooking the big picture of foundational cellular health. So, they might have been labeled. Maybe the other symptoms are actually people with the other symptoms are literally maybe ignoring, are they asking what's going on a global scale within that patient, whether they're having, how's their sleep? Are they anxious? Are they, having other pain, shortness of breath, dizziness?
Couple other questions here. Here's three. Any contraindication with gallbladder removal? What about people with panic attacks? And how about ankylosing spondylitis? Would you use it topically as well as orally?
Okay, well, ankylosing spondylitis is an HLA-DR, a syndrome, genetic, makeup that actually allows one to be more predisposed to the arthritis. Because you can apply it topically, I think it would help. It's not going to cure, but essentially what it's going to do is mitigate that inflammatory component so the person can clinically feel better, especially applying it topically to the back and tasting it internally. Anxiety is basically inflammation of the brain. And essentially with proper nutrition and the omega-3s, 6s, and 9s that go along with sole and core, with the black cumin seed, and you're actually feeding the brain. It's crossing the blood-brain barrier because it's actually a fat-soluble. I mean, it's fat-soluble. And the brain is fat, and it needs omega-3s and 6s and 9s, mostly omega-3s and 6s. But essentially, you're feeding that brain. You're causing, with good nutrition, you can actually reverse anxiety, because a lot of it has to do with vitamin and mineral deficiencies. Also, you're absorbing your nutrients better on the rest of the cells. So when you actually feed the entire body, you're actually allowing mitigation of anxiety and panic. Also, when you actually, let's say if they're on a Lyme disease protocol, that's very common in Lyme disease and co-infections, is anxiety and panic. But if you actually separate the blood cells, it allows for the protocol that's supposed to be used to be absorbed better, and mitigate the infectious source. And then the other thing is, you were asking, what was the third
Gallbladder.
thing?
How about gallbladder? People who have had their gallbladders removed, of course, have issues with emulsifying fats. So what do you recommend to people who have had their gallbladder removed?
I don't really see. I actually worked with someone with the gallbladder, and she just started a sole. I think she became a distributor on a small package a couple weeks ago. And she was afraid of it because of her gallbladder, and she's starting to tell everybody about it. I mean, I think it doesn't really matter, because you're actually allowing the gut to heal. These fats are basically broken down into the elemental form. So I don't see it there being a contraindication. It helps everybody with inflammation, whether you have a gallbladder or not. I have not noticed. I mean, I've had some people very fearful not having a gallbladder, but I don't think there is a contraindication.
How about people with sickle cell anemia? having reduced, have you had any cases of someone suffering from sickle cell having reduced pain and symptoms? I understand it's genetic, but I've had a lot of people ask if Soul can help these people.
I haven't seen too many people with sickle, so I have seen a couple, because I'm like, gosh, you have sickle cell disease? Or, I mean, I think they had sickle cell trait, and I mean, it benefited them. I mean, I don't think anybody who actually goes through the detox that's necessary, I don't think anybody, I mean, some people have detox, some people don't, but I don't think anybody who has actually persisted in taking it and stuck it out, the detox, has actually ever regretted taking Soul and Core. I do have a couple of people that I had about 3 people tell me they couldn't take it because of lectins. Now, one of the people, I mean, I've given it to hundreds of people, you know, through the testing, and then, you know, a large portion decide to get it altogether. But there was a few cases where they were like, they had reflux. Okay, I had one with reflux, another one who was on lectins. They had lectin. They were allergic to lectins, and they blamed the Soul, and they were overreading, doing their own research, and they stopped taking it because of lectins. Lectins is basically seeds, you know, induced allergies, and they're advised. There's a lot of literature out there, so people who do their own research, oftentimes, you know, look, this is lectin. Now, I think you're looking at a tree. Honestly, I think they're paranoid. You're looking at a tree in a burning forest, and they're really, I hate to say it, okay, fine. You're looking inside the box and looking at the big picture. They're just looking at a box. And honestly, I mean, I guess there are allergies. Some, I mean, if they're allergic, and, you know, obviously I can't force them to take it, but I did have a few people stop because worrying about lectins. And I actually asked Dr. Weeks about it, and he didn't seem to be concerned about it. So I don't know about the lectin thing, but I did have some people stop taking this because of lectins.
All right, we have a couple more minutes here and a couple more questions. So let me see if I can get through these last couple questions that are here. There is a question about type 1 diabetes, and there's also a question about whether you've ever seen anybody receive these products through a feeding tube. I can tell you, I do know about some people who have been given these products through a feeding tube. Do you have any experience with that?
I've had a few.
And with type 1 diabetes.
Well, type 1 diabetes, it actually, what's beautiful about Soul is it actually stimulates the regeneration of islet cells. I think because type 1 diabetes is actually an inflammatory attack on self. It's actually, I mean, it's the destruction of the islet cells, where they're dependent on exogenous insulin. And so long-term studies, I've only been taking this for, you know, less than a year. So, I mean, but you know, people's numbers, they require a little bit less. Mostly I see type 2 diabetics, not type 1. But like I say, there's no claims, but there is anecdotal evidence of regeneration of islet cells, and that is the insulin-producing cell. So I think there's nothing to lose, but personally, I don't have that much data on it. But essentially, everybody's going to improve on the reduction of inflammation and pan. I know that there are people with chronic illness with pan endocrine dysfunction, with, you know, pituitary and thyroid, and they have diabetes. I actually had one with type 2 diabetes, and it reversed. A lot of times it's type 2, not type 1. It's not just isolated to, but when you have pan endocrine, you know, adrenal issues, I mean, basically all the endocrine organs are not functioning. When you reduce that inflammation, you actually reverse things. And I think you could project that, you know, in isolated diabetes, that isn't, you know, a virally induced, genetically predisposed inflammatory attack on the islet cells. So I think that, you know, as an adjunct, there's definitely, I think there would be something benefit with Soul and Core. in these
All right,
patients.
great, and thank you. And lastly, there was a specific question again about with the person who's perhaps had their gallbladder removed. Would you think that perhaps core might be more beneficial with the reflux due to the removal of the gallbladder than sole? I imagine is the question here. Any opinion about sole?
It is all up to the individual. Okay, so I think that, you know, if they test the product, that a lot of this, it is kind of like an experiment, okay? And you have to be your own guinea pig. And honestly, if you reflux on sole, try the core. You know, if you don't, I mean, if one works better for you, then go with that. I think that's why we have multiple products, and, you know, they both tackle inflammation. I think sole is a little bit better, you know, for inflammation, and core is a little bit better for detox. But if someone doesn't, you know, gravitate, I mean, that's why it's good to try both. They both have a money back guarantee. I have to thank Ethan Leeds for introducing me to this product. And he, you know, was instrumental in helping educate me about, you know, because in medical school, you know what, we don't learn much about nutrition. So this is seriously a nutritional product. He has some amazing testimonials of people for 4 years that helped a lot of people, including his wife, you know, recover from metastatic cancer. No claims, but it's amazing how optimizing the body on a cellular level by dealing with nutrition and inflammation and toxin removal can actually help people with almost anything, from cancer to chronic illness to autoimmune diseases to just even healthy people, athletes. So I think that this would be a good adjunct for anybody.
Now, thank you. Now, I would just, if you want to take, I know we're running a little late and we're going to have to wrap this up real soon, but I would love it if you would just give us any leading thoughts that you've got about the product Bend, because we're just getting to know this product Bend. Do you have an experience with Bend? I know most people on this call probably haven't even tried it yet, but if you could,
I love it.
A minute on Bend, I think that would be wonderful.
Okay, this is my box of Bend. This is my box of Bend. I actually got some at the convention. And I was impressed with it because it has, you know, vitamin D, vitamin E, vitamin K, niacin, vitamin B12, and they're methylated. Okay, so that means people with MTHFR are actually going to process this without any detox issues. It basically has pumpkin seed oil, milled flaxseed, black cumin seed, which, you know, also reduces inflammation, just like sole and core. I mean, at least the wonderful addition of this, it helps with the brain because of, you know, the vitamin B12 and niacin, vitamin K, vitamin E, and vitamin D, which are all wonderful for brain health. But also it's for joints because it has glucosamine and levagen and fermented hyaluronate and bioperin. And it tastes like a tangerine. It's actually, I have to now I'm like, you know what, I'm going to taste it. It's like a tangerine curry. That's what it's like, curry tangerine.
That's the turmeric that's in there. Yeah.
Yeah, because there's turmeric. And I actually find I sleep better. The days I skip the Bend, I actually don't sleep quite as well. I have not really mass tested on people because I just don't have, I have a limited supply. But for my personal use, I've noticed that I sleep better at night. I actually, this sounds kind of, I don't know if I should say this. Oh gosh. Things have woken up that were asleep for a long time. So it actually kind of optimizes your body on. I actually have run, I haven't run as much because I got really busy with my business, but I can run and literally have no pain. I don't have aches and pains in my joints, but I did occasionally, but I'd if I didn't run for a month and I went running for 8 miles, it didn't cause me any pain. You know, I don't have any soreness. And that's kind of I'm 50, going to be 53 at the end of the month. So I'm not like a teenager who can just do this stuff, but literally I feel like it's protecting my body from, some of the wear and tear I put on it. And I don't necessarily, I don't recommend running 8 miles without training, but I have. And I think Bend is, probably partially and Soul and Core, because I take all of them. My running buddies like the Soul, and I use it instead of running gels when I'll take 3 or 4 Soul just in case, and I'll rub it on my knees if I have issues, but I don't really have any pain, and I have to push it. I think I ran 19 miles untrained, and I didn't really have any soreness. So I do believe these products feed the body, and aging can essentially be biohacked by the type of food that you eat. The combination of, I think, Bend, it helps regenerate joints. So I don't have any knee issues. I did like before actually, when I ran, I would, like when I got beyond 5 miles, I would have occasional joint pain in my knees. When I did half marathons, sometimes I had to finish, like ow, it hurt at the end. If I got training, well, I could do it a little bit faster. I'm a little slow, but if I got to this speed, that wasn't embarrassing, because my PR was much better, 4 years ago, because I used to run daily. Now I run like weekly. So my time is much less, but at least I'm not in pain, and I think I probably could.
Now, Susan, I would love to honor the fact that we've been on this call for about 1 hour and 10 minutes.
Oh, really? I'm sorry. Time flies when you're having fun, right?
Very grateful for the time. There are 1 or 2 questions. What I'd like to do is thank everybody for getting on this call today. And thank you in particular, Susan, for being willing to come on and share your expertise and your enthusiasm and your curiosity about health, and your generosity. If you do have a couple more minutes, I think that anybody who needs to get off this call, I appreciate that you've all come on. It's been fabulous. If you have a couple more minutes, there were 1 or 2 questions that maybe we could ask you to answer if you'd like, and then I think we have to ask people to get back with the people who invited you on this call. We could spend days doing this, but lastly, simply, is there an indication? I think you've answered this already, but Soul, Core, Bend, how do you tell people which one to take? Should people be taking all 3?
Ideally,
some parting words on that, and then we'll look forward to the next time that we can get together.
Well, ideally, being on through all 3, but Bend has not been available. I do actually need to send some people some Bend that I promised. Life got away with me. But I usually start with Soul and Core, and then if they have joint issues or brain fog, adding some Bend. Especially when it becomes available. Anything else? Essentially, I recommend for everybody. I think everybody deserves. There's no reason not to take this. It's just a great foundational layer for inflammation, because essentially, there's no negatives except, obviously, people can't handle the detox, but essentially just stick with it, because ultimately it is good for you. It's food. And I think
food be thy medicine, right? I think we were
let medicine be thy food, and food be thy medicine. So
and do no harm, right?
Right. I really see this. I've had some. I want to say, like, I was helping someone, and her husband has cancer, and he mows the lawn. Okay, now because of it, and he actually. She just drank the husk because they had financial limitations. So she would give him the Soul, and she would lick the husk, and she was amazed just licking the husks.
Just licking the inside of the package, how she was getting benefit. Isn't that fabulous? Everybody should remember, when you're done drinking and squeezing everything that you can, take a pair of scissors, cut the packets open, and make sure that you use every single last drop, because there's always some left over. But I would like to really thank you, Susan, for once again, for your generosity, your enthusiasm, all of this valuable information. Keep your questions coming, everybody. Ask the questions of...
Oh, I had another testimonial, I forgot to say.
One last one.
I basically got bit by something and it was painful, and I actually applied Sol to it, and within 5 minutes, I actually didn't see any redness. I didn't know where the bite was. So, and actually one of them was a tick bite throughout. I mean, it was kind of scary, like worst nightmare. But essentially, I applied Sol to the tick bite, and the itching used to be itchy when I first got them. You know, it itched for like a week or two, but I could actually mitigate the itch, and I think that helps the transmission of any tick-borne illness, because if by reducing the inflammation at the site, you're actually reducing the exposure to the blood supply to the toxins, to the spirochetes, so they are loculated essentially into that area. So I think that's a very important, I failed to mention that. There's just so many things it's good for that I just had to, mention. Yeah, when I got bit by a tick, I applied the Sol to the site. And
we
so
recommend it for in our first aid kit. Bee stings, burns, slamming your finger in the door, you name it. We've seen it be a very, very valuable first aid agent. So, all right. Well, I know it's very late in Greece right now. They're 10 hours ahead of us. So that's midnight in Greece. So I'm sure you're all very sleepy. Those of you in the UK and others of us here in the United States. So once again, Susan, thank you so much. I think that we're on an amazing journey together. We all have lots to learn. We all have lots to contribute, but keep collecting your stories, keep collecting your experiences, keep sharing these products, because together we're really able to make a huge difference in this world. So thanks for your part in it, Susan and Sarah and Ethan and everybody who's joined us this evening. I'm gonna stop the recording now. I have to actually get on to some other stuff myself too. So
are we recording this? Do you know if we're,
yeah.
okay.
Yes, we are. And I'm gonna end it right now. Okay?
Okay.
All righty. Bye.
All right.